We are back in the danger zone when it comes to heat, and many people are looking for ways to stay safe during our extreme temperatures. Joining us now to share life-saving information is Dr. Nick Staub, the Assistant Medical Director at the Maricopa County Department of Public Health. Thanks so much for coming in.
Thank you.
We're going to give people a very quick lesson on who handles what when it comes to heat relief, because I mentioned to you it's frustrating for me sometimes and others when we talk about heat relief, who's in charge of doing what. So Maricopa County is part of a regional heat relief network that's really overseen by MAG, the Maricopa Association of Governments. Take it away, Doctor.
Yeah, that's correct. So the Heat Relief Network is really our best effort to provide places for people to get out of the heat and into cooled, air-conditioned spaces. And those sites are provided by a large group of people, so many community-based organizations, faith-based organizations, cities and towns, all working together, organized by the Maricopa Association of Governments and supported by public health to expand and make that system more robust.
So is it all voluntary, or are people required to participate?
At this point, it is voluntary, and we ask for participation really in those areas of town where we're seeing either that they don't have coverage with heat relief centers, or we're seeing higher risk populations that need better access. So it's really all hands-on this summer, as it has been in summers past, but really focused at reducing that heat-related illness and the staggering number of deaths that we saw last summer.
Last summer, we made national headlines. It seemed like every day in July we were national headlines, and certainly they're watching us again to see whether we're going to have a repeat of that or whether we've made any improvements in terms of preventing deaths and providing cooling centers and providing shelter for people. Are things any different this summer?
Yeah, we've been working all year. We've been working since the end of the last heat season to prepare for this season. Our heat season is predictable and it's long. It's from May to September. So we know that we have to plan for that and provide these services. We are working with, again, from state level, county level, local level, to make sure that our heat relief sites are open longer, have longer hours of operation, more days of operation, so are operating on the weekends. And then we've partnered with 211 to make a resource for people to call in, find out where the resources are, where the sites are, and other resources so that they can stay cool.
So I know you're not in charge of this, so I'm not trying to put you on the spot. I do know from my past reporting that when it comes to people experiencing homelessness and people dealing with substance issues, that finding experts, people who are really specifically trained in this, can be difficult. The staffing can be a challenge. Is staffing a challenge for cooling centers? Is that a reason that it's not like a no-brainer for us to just have 24/7 cooling centers available?
Yeah, staffing is a challenge, as it often is, with many responses. And so we have Maricopa County Medical Reserve Corps volunteers available to heat relief centers to bulk up that staffing. And then we're using a lot of these community-based organizations that serve those specific populations that you mentioned. So individuals experiencing homelessness and those who are using substances to help our heat relief centers cater to those people if they need to get out of the heat.
What are we doing differently this summer that you think people should know about?
So as I mentioned, the big things are expanding hours. So going into the evening hours, a lot of our sites used to close around a 5 o'clock closing business time. And we know that the hours from 5 to 7 are really important for people to stay out of the heat. We're opening, expanding hours on the weekends, using 211, just kind of getting the message out there. So we've partnered with the city of Phoenix to increase signage outside of heat relief networks throughout the county. So really just trying to increase access.
Individuals who do have access to air conditioning, those of us who are fortunate enough to just pop in and out, what do we need to know or need to do to protect ourselves, if anything?
So I like to say that everyone who's living or visiting Maricopa County during the summer is at risk for heat-related illness. We need everyone to have a plan. You never know when that reliable air conditioning is not going to be there. And so we need people to think about where they would go to get to stay cool. Think about your community. Think about loved ones, or if we have older people living nearby, check on them, make sure that their air conditioning is working. And then, basics, stay hydrated, stay out of the sun during the hottest part of the day, and really watch out for each other.
Doctor, how do I know I'm just not hot and like, ugh, this is just gross, or it's something more serious?
Yeah, it's a wide spectrum, and we all get hot when we go outside during the summer. But if you start to be confused, if you start to have a headache, feel nauseous, if your skin stops sweating, those are signs that your body has gotten too hot. You need to immediately get into a cooled space. And for some of those more severe signs, seek medical attention.
Where can people get information on either how to protect themselves, how to support other people who may not have access to AC, or businesses and nonprofits that maybe want to step up and do what they can to support?
Yeah, so visit our website at maricopa.gov/heat. We have all of the available resources that are available through 211, as well as other links to county resources, places you can go to find out how you can help.
Dr. Nick Staub, Maricopa County Health, thank you so much for coming in. Appreciate the information. I'm sure we'll talk again this summer.
I'm sure we will.
Thanks,
Christina.